Hello, my name is Tahita Boyd White, and it is my pleasure to introduce to you a woman that means a great deal to my family and me. On April 19, 2019, my youngest daughter, Nala, was born at 23 weeks, weighing only 1 pound, 4 ounces. She spent 4.5 months in the Neonatal Intensive Care Unit at Duke University Hospital, where she was cared for by Miss Faith Blackwell Hughes, who is a clinical lead in the NICU. Miss Hughes is a lifelong resident of Person County, one of 10 children born to Sam and Lily Blackwell. Her family's roots in Person County go back to her great-great-great-grandfather, who acquired a large amount of land in the southern part of the county after the Civil War. In recognition of NICU Awareness Month, Ms. Hughes invited us out to her front porch to discuss her life, her family, and her more than 30 years of experience working in Duke Hospital's NICU. We hope you enjoy her story.
Well, I've lived in Person County all of my life. I grew up in Southern Person County, and I went to South Elementary and then to Southern and then Person High School. I graduated from Person, and after I graduated, I went to East Carolina, where I majored in nursing and graduated with my Bachelor of Science in Nursing. But prior to that, growing up in Person County truly didn't mean a whole lot when I was growing up, because we never really got out too much with 9 children on board. My parents lost a son that was the 3rd child. But growing up in a large family, I can't even begin to tell you the fun that we had. There was actually 20 years between my oldest brother, Roy, and my baby brother, Gary. So as you know, there were somebody in the house all the time. We had a ball. And the extended family during those times were like your brothers and sisters. So I had multiple cousins that were always in the house, or we were always going to their house. But growing up in Person County I remember a lot of things that I think you kind of sort of push back as you get older and don't think about as much. But those are things in my past that molded me to be the person I am today. So I don't regret those learning experiences at all. I felt like when I was growing up that color was a factor, especially initially on. But one of the things that my parents taught me to do was to rise above that discrimination, to always hold your head up and you be the best that you can be. My mama always had a saying, if you only have one dress, you wash that dress every night. You dry it, you press it, and you look good for the next day. I guess that's the reason why my daughters think I'm a little bit crazy, because that's one of the things that I love to do is to wash. Because I always make sure that I wash and put clothes away. I never leave clothes in a basket. I always hang them up or press them if they need to be. And that's something that has been instilled with me with my mother since I was a child. And Daddy, Sam, always told me, you hold your head up. Don't ever let me see you with your head down. If you do hold your head down, he would always lift my head up and say, lift your head up. You are better than that. And that's my life with my parents. It was a short-lived life because I was 23 years old and a senior in my last semester of nursing school when I lost my mother. And I hadn't quite reached 30 when I lost my father. But they instilled in me so many valuable traits that I carry with me today, and I pass on to my children as well. So, ECU, the party in school. That's what my daddy said when I told him I was going to East Carolina, and I was determined I was going to prove him wrong. So, I knew from the day that my baby brother was born at Duke Hospital that I would work there one day. And that was my goal. And I accomplished it in 1987 when I entered through the doors as an RN at Duke Medical Center. Prior to that, I was a PNA, a professional nursing student, at the full-term nursery. And I was actually, as carried over with that, I was there for the birth of one of my nieces. And I was able to help her mom give the baby a bath, do the teaching and stuff for my sister-in-law, which was great because that also built my foundation for nursing. When I graduated from ECU, like all nursing students, they tell you start at med-surg. So essentially that's doing floor nursing. You get your bounds and that's where you start out. So I did that. And it only took me 9 months to realize that I was in the wrong place. So I met this young man who has a wife on the unit that I was working on, and I told him about my love for children and babies. He said, come up and talk to our nurse manager. I'm pretty sure she'll hire you. And I thought about it, and I was like, well, maybe I would. And it's funny because when I started nursing, there was a nursing shortage. So that to the point where nurses were doing stuff that earlier than what they should have been doing. And I was finding myself in some situations that I wasn't comfortable with. So I said one day, okay, I'll go and talk to her. So I went up to the NICU and I saw this lady that was taking care of this itty bitty little baby. And I was like, oh my goodness, I'd never seen anything that little that was actually a human being and breathing. So followed her around for a little while, went and talked to the nurse manager. She hired me on the spot and told me, when do you want to start? That started my experience as a NICU nurse 34 years ago. I've never been anywhere else to do any kind of nursing. I found my house. Not only my house, but my home. I am a NICU nurse for life. I've always told people that when they would say, well, why don't you leave? Everybody else is leaving. They're going to do something else. They're going here. They're going there. No, I am a Duke NICU nurse. When I started, as I said, there was a nursing shortage, but we made it through. And as I went through my nursing career, Duke established a clinical ladder for its nurses where you could actually climb the ladder to different positions, which was an increase in pay. That was a real incentive. But my love for what I do and where I was prompted my desire to climb the ladder. So I got certifications and I did everything that I needed to do. I became one of the best bedside nurses Duke ever had. Until this day, I still hear that. Taking care of patients in Durham, very close to Roxborough, as you know, can be interesting because I've taken care of quite a few babies from Roxborough. And that's been really nice because I've actually seen quite a few of them as they grow. And quite a few of them are actually grown today. So, with that being said, this month is Neonatal Awareness Month. So what is a NICU nurse? What does a neonatal intensive care nurse do? Well, we take care of Duke's smallest patients. How small? I have taken care of a baby that was this big, that long, literally. I have a picture in my house of me holding her in my hand. That's what I do. That's only a part of what I do, though, because the neonatal intensive care does a lot of other things. We take care of sick infants. We take care of infants with cardiac issues, metabolic issues, and any kind of issues that occur with babies we take care of. Yes, the majority of what we do is taking care of preemies. When I started in the NICU 34 years ago, the survival rate for a 28-weeker was less than 50%. Now you think for a minute, I want you to think about this and what a 28-weeker is. Full-term baby is looked at 38 to 40 weeks. So we're talking about a baby that's being born 10 weeks early. And during that time, our babies had a lot of breathing issues. They had a lot of issues, GI issues and trying to feed, and a lot of other issues as well. They had all of these issues because we were trying to take care of babies that aren't supposed to be here. And we didn't always have what we needed to take care of them as far as technology. But as time has grown, I've seen the technology of the NICU expand exponentially. At this point, we're able to save 23 weekers that are less than a pound when they're born. You may think that that is crazy. Trust and believe me, so do I. But I know that my faith is driven to the point where we take care of our babies and we give them the best care possible. Do we save every baby? No, we do not. But we do know how to ease that family into transitioning that baby. Why do I stay in the NICU knowing that? Because I see so many babies that you wouldn't think they would have made it come out of that unit. Some of them come out and do very well and are, walking, talking, no issues. But occasionally we do get that baby that has CP, which is cerebral palsy, and some other issues. But you know what? We know how to teach these parents so that you may have these children be the best that they can be. And that's what our goal is. When we have a baby who had a difficult time in the NICU, we accept that. We work with the parents, and they do very well. Every now and then we'll have the baby that comes in that I've seen some stuff that you would have to question, what did God do? But in those cases, and the baby doesn't live long, but in those cases I've learned through the years that you don't question, why did God do this? Because that child is a story for somebody's life. There's a parent out there that needed that child for those 8, 10 hours. For whatever reason it is, I don't know. And sometimes I've had parents to come back and say, you know what? It prepared us for the next child because we had a child with the same thing. And now we know how to deal with it so that our baby is growing, that our next child is growing and is doing very well. And they bring that child back so that you can see that child. And you look at that child and you see how good God is. Because if they had not had that previous loss and we knew how to manage it, the same thing could have happened again. But that's the genetic part of what we do. And that's why when we ask parents, do you want to have genetic testing done? It's not that we can experiment or play around. It's so that we can prepare these parents, if they have another child, to make it better. I have often wondered and felt like God had a sense of humor. He proved it to me time and time again. And it was very evident 3 years ago. My daughter had came home from school and she was looking kind of funny. And I was like, are you okay? She said, I have a doctor's appointment and I need for you to go with me if you would. And I was like, okay. Mind you, she already had a 1.5, almost 2-year-old. So I was like, okay, I'll go with you. And I was like, what kind of appointment do you have? She said, I'm pregnant. I sit back for a little while and I said, okay. I said, well, how far along are you? She said, 6 weeks. And I looked at her and I said, you know, you're having twins. Why would I say that? Well, my mother-in-law had 3 sets of twins. So twins ran in the family on my husband's side. And when I looked at her, she was larger than she should have been at 6 weeks. That's why I said it was more than one. And so her grandmother came and saw her and she was like, yep, it's more than one in there. It's more than one in there. And so we prepared ourselves. And so when she went for that appointment, and they did the ultrasound to make sure that, you know, there was a baby in there. And so she's laying there and the lady puts the scope on her belly, and I look up and I said, Samantha, you're having twins. And I went and I looked again. I said, wait a minute, Samantha. And I looked at the tech. I said, there's a third one up there. She said, yes, ma'am. I think we need to get the doctor in to talk to y'all. So everybody knows me over at the perinatal clinic because with me being a nurse, a lot of our doctors are familiar with me. And when she walked in, she went, oh, my word. I said, yeah, God has a sense of humor. I said, only He would give a 30-year veteran triplets. So she comes in, and of course, we go through the normal things. They ask if Samantha wants to reduce. That's to take one of the babies out to give the other twins a better chance, give the other two a better chance. And Samantha's thing was, Mom, I can't do that. She was like, how do I know that I'm keeping a serial killer and I'm getting rid of the next president, to come along for the future? She was like, so how can I gauge that? And then the doctor, of course, informed us that, carrying twins, because she was a little heavy, carrying twins at her weight wasn't good. And that, the possibilities of losing one. Well, Samantha said, no, I'm having all of my babies. So we moved her back home. My oldest daughter, who was in Abingdon, Virginia at the time and had been there for about 3 years, actually was probably closer to 4 years, decided that she was going to move home to help with the babies. Because she was like, Mama, that's going to be hard on everybody, and y'all are going to have to do too much. I can work from home, so I'll be there to help her. So we move everybody back home, and the babies come. Close to the doctor who had initially told her was completely in disbelief that Samantha had carried those babies for 35 weeks and 4 days. She was like, she said, she was just completely amazed. Well, Samantha gave birth, and she gave birth to 3 healthy triplets. First came Alyssa. Alyssa's my little mama. They pulled her out first. She was the one that we had said throughout Samantha's pregnancy that she kept everything closed because she was at the bottom. And so she was keeping the gates closed, and she did a good job. But unfortunately, she suffered with her weight because the other 2 were on top of her, so she was the smaller of the 2. She ended up staying in the NICU for about a day or so. They just wanted to make sure her breathing and everything was okay. She was good. So time to go home. About a day before it was time for her to go home, the doctor said that they would have to keep Alyssa in the special care nursery. Our special care nursery is what we call our feeder grower area, where she's able to grow and feed and gain weight. So one of my managers at the time went and talked to them and said, okay, look, here's the deal. You got a NICU nurse. Let's send this baby. You need to send this baby on home with the other 2. That child will get more care at home, better care at home than she will here. So they let her come home. So we brought all 3 babies home. And it is true when they say it takes a village. Between my work family and my church family, we were so blessed. We were blessed beyond measure. All the love that poured out for these babies and continue to pour out. So they turned 3 in July of this year, and they are a force to be reckoned with. My little Alyssa is truly a little mama with her troll attitude and all. So she was a troll for her birthday. Amaya has always loved to be by herself. This is my child that would cry to get back into the crib to be away from Sam and Alyssa. So I call her my little unicorn. She likes to play out there all by herself. And Sam is nothing but true boy from the time he wakes up to the time he lays down at night. He's my boy. And Gabe is their older brother who looks out for him. God has truly blessed this Blackwell Hughes family. I can't go any further talking about my family if I don't mention my husband, David Hughes. He has truly been my soulmate. A lot of people say that they never find theirs. I found mine. I asked God to send me a man that would love me for me. And he has been on point, never wavering for 32 years. I thank God for that. I would just like to mention one other thing before I go. The COVID is out there, and it ain't going nowhere until we get some control over it. I know that a lot of people are saying, have a whole lot of things to say as far as it's a hoax, that it's experiments, that it doesn't do what it says that it's going to do, that you're losing control. I've seen patients on ventilators that die because of this virus. Please, if you have not been vaccinated, get your vaccination. If not for yourself, do it for your children. Because you think that it's not doing any good, but we as adults have to immune ourselves so that in time we can develop that herd immunization to take care of our little ones who are in school and being exposed. So please, please get your vaccinations. And if I don't mention my sister, Sandra Yellock, my brother Gilbert Blackwell, my other brother Samuel Blackwell, and my other brother Lawrence Blackwell, those are the ones that are still with me and are my driving force as well. Thank you to my church family. Thank you to my work family for being with us and supporting us. Thank you.